I take my job as a doctor, which really comes from the word Latin origin of educator, very seriously. And so when they come in, the first thing I want to do is educate them on their disease process. And when you have something like tumor, when you have something like an intracranial tumor, this is going to bring about a good amount of anxiety just with those phrases. And so really putting their situation into clinical context and what does it mean and what are we going to do about it, I think can be very reassuring to the patients. My practice is quite interesting. You know, sometimes people come in and there's something in their ear canal and I can show them on the screen and say, hey, here's the lesion, this is what we need to do about it. It's a bit of a different concept when they come in with a vestibular schwannoma because it's this abstract, there's something in my head, what does that mean? Is this a brain tumor? And what is the size? We bring up these size, comparisons, but how do you put that in the context of your own head? A vestibular schwannoma is a benign tumor on the nerve of hearing and balance. This is kind of a complex nerve. At the brainstem, it starts as one solid nerve, but as it goes towards the ear, it branches off into 3 divisions, a division of hearing and 2 divisions of balance. The vestibular schwannoma is actually a benign tumor on the balance part of the nerve. However, the main side effect or problem with the tumor is hearing loss. That's why you may also hear it referred to as an acoustic neuroma. About 95% of the patients come in with hearing loss as their primary symptom. So when we talk about putting together a treatment plan for a tumor such as a vestibular schwannoma, really goes into a number of different factors. One factor would be the tumor size. What deficits has it caused? And then we kind of put all those pieces together and what are the patient's concerns? Quality of life is a big factor for these vestibular schwannomas, and so we want to make sure that the patient's concerns are at the forefront of any treatment plan that we will consider. There's a lot of anxiety that comes with these initial meetings. I take my job seriously of educating and showing them and giving them context of what it is that we're actually talking about. Because these tumors come in very, very different sizes and different clinical problems, and we need to be individualized with the care that we give. It's certainly not a one-size-fits-all. The care of patients that have vestibular schwannomas is very rewarding. In particular, I kind of like when we're able to put it into context for the patients that this is a benign tumor and actually you've got options. And you know what? And a lot of the time, you're in the driver's seat with what we want to do for this. My job is to educate you on the tumor and your specific situation, but then ultimately, you're going to make the decision on, do we watch this tumor? Do we operate on it? Or do we provide radiation for it? And all of those can be the correct answer for specific patients. Our program is unique, one, for its multidisciplinary care. We kind of have all aspects of vestibular schwannoma care covered through Siteman and Washington University. Kind of a newer model is that, yes, your time with the doctor is important, but you also need help coordinating. What do you expect? What are you going to expect from the multidisciplinary visits? Or what are you going to expect during your hospital stay or those phone calls after you've had a surgery or a treatment? And that's really where our benign tumor navigators come in. These are nurses with special expertise in these tumors, and maybe more importantly, in what the patients are going to go through and their expectations. Of course, if there are questions or side effects or things that are on the medical realm, they get it back to the physicians and we get you an answer. But from some of just the basic anxiety that comes with the multidisciplinary treatment for these tumors, it's nice to know where to go, when you're going to be hearing from us, and what to expect during the treatment course. I could talk all day about the history of vestibular schwannoma cares and how it's evolved over time. 100 years ago, they were talking about mortality with these treatments, and now we're talking about functionality. In my particular areas of interest, I'm really interested about their hearing and what can we do to either preserve hearing or restore hearing. And that's really exciting. It's fun to see if we can improve on some of the ideas that we had of preserving hearing with these tumors, or even new concepts like restoring hearing, maybe even with cochlear implants in the setting of a tumor.